Hello everyone, welcome to our new podcast. In this podcast, we are going to discuss about adult health nursing. As you all know, your exams are very near. While are studying in BSc nursing 3rd semester and 4th semester, they are going to study this subject in the semester based system. I am Swarnashri LP. I am a nursing educator. I have 2 years experience. Along with me,
I'm Aparna. I am a nursing educator. I have 4 years experience in this field.
see, ma'am, actually in this podcast, mainly we are going to discuss about this adult health nursing. No, this is the subject like a combo subject. Here we are going to study about the anatomy and physiology. Means we will take one recap. Okay, already we studied in a previous semester, and we will get one recap of anatomy and physiology of a particular system. And meanwhile, we are going to study about the disease conditions, and meanwhile, we are going to study about the surgical procedures.
I think the students not having much about this subject. So we can start the unit one by one. Okay.
Yes, ma'am. I too agree with this because the students never have much knowledge because they will go and they will study about the subject and all, but they will not have a grip on the syllabus review. So here we can discuss unit based one by one unit we can able to
The
discuss.
brief details we can give this.
Yes, ma'am. Yes, ma'am. That will make sure to help to the students to get better marks and they will get a good grip in this particular.
We can give some tips also.
Yes,
Okay,
ma'am.
how to score mark this unit. Okay.
Okay, they will get one idea what is the important topic where they have to focus more. Like that they will get, ma'am.
Okay. So in this subject we have 11 units. So we can talk about first unit, nursing management of patient with disorders of ENT.
Yes, ma'am. In this first unit itself, the students will able to gain their knowledge regarding ENT. ENT means what? Ear, nose and throat. The students will gain the knowledge regarding the disorders which will be comes under the ear, nose and throat. That is what they are going to study in this particular first unit itself.
So ma'am, what kind of knowledge getting these topics?
See, when they are studying this ENT, ear, nose and throat, mainly they are going to study about the disease condition along with the review of anatomy and physiology. When it comes to the ear, they are going to mainly focusing on the otalgia, foreign bodies, and meanwhile they are going to study about the deafness and management. Okay, nursing management.
That is main important things in
Yes.
management.
Yes, they have to focus on the nursing management in these disease conditions regarding ear. Then they are going to focus, they will know that what kind of diagnostic test will undergo the patient
That
if is
history collections,
Yeah.
the physical examination,
Yeah.
the diagnostic test, like that.
Yeah, like that they have to study. And meanwhile, when it comes to the nose, okay, where they are going to study about the rhinitis, sinusitis, these kind of things they are going to study. When it comes to the throat, the tonsillitis and laryngitis, these kind of things they are mainly focused. The thing is, the students have to more focus on the management. Along with that, signs and symptoms, causes, then integrated pathophysiology. That is very important.
So we can expect 5 or 10 mark question for this topic,
Yeah,
no?
yeah. Definitely we can expect the 5 marks questions from this
Because
short
the,
essay.
what is ear, that definition, stuff, management,
Yeah.
nursing roles also.
Yeah.
Like that we can expect this topic.
Yeah. They will ask like management of deafness, like that kind of questions, or else they can when it comes to 5 marks or 10 marks, they can ask tonsillitis. Here we can particularly mention that the tonsillitis we have a surgical procedure, that is what tonsillectomy. Tonsillectomy means what? The removal of tonsils. Okay, for that we need to add preoperative, postoperative care. Okay, that is very important. That and all we already explain in our channel. If they want, means they can go and check. Like that they can learn the things regarding ENT. This is about first unit.
First unit.
In the second unit, they are going to study about the nursing management of eye disorders. That is what ophthalmology. They are going to study this unit. In the second unit, the students will able to gain the knowledge regarding
hospital side also.
Yeah.
Because we are working in nurse also, we have some much knowledge about eye.
Yes, eye department. There is a certain different department. Okay, that is what ophthalmology. In that department also, the students, if they study
this department is something specialized field, no?
Yeah. They want some specialized knowledge to work in the ophthalmology department. That's why they want to study this one. Okay. Then when it comes to this eye disorders, each and every disorders they are going to study. For example, cataract, glaucoma, and most of the eye disorders they will study, and myopia, hypermetropia, the refractive errors.
Then the most important, the eye donation and banking. So that is human emotional things, no? That eye donation, the giving some new life to others.
Yes.
So this eye topic is something different
and special things. The students will get much more knowledge. Okay, eye donation, regarding eye donation in colleges and all, they used to tell to the students, right, donate your eyes. Because we should not waste the eyes after our death. That will be very useful to others. Okay, after our death, some other two eye will get a power to see this world.
So this chapter we can accept something that surgical management, the nursing responsibility. So this type of questions will accept.
Majorly what will happen, the elderly people will get more, okay, and eye irrigation, like that kind of procedures, okay. When it comes to this eye disorders, the elderly people are getting more eye disorders, and for that purpose they'll undergo some surgeries and all. They can include the preoperative, postoperative care while writing a particular disease condition, whether they need. Okay, according to the question only they need to answer. Okay, better I will suggest students wherever they are appearing for any examination, especially in the adult health nursing, they have to
like that. The condition wise we can score more mark, means first definition, then classification, types, management, then nursing roles, then also diagram also. Neatly draw the diagram also, we will get good score.
Yes. Actually, in the question paper itself, they will mention wherever the diagram needed, they have to write the diagram. They have to draw the diagram. That's what I can personally believe, that whenever the students are writing the examination, if they will show the defect, whenever they are writing about particularly the disease conditions, if before starting the things, they can at one corner they can show the defect. This is here the defect has happened. The evaluator can easily understand that this student knows something else. That is the tip they can use in the examination, and they will study about the eye disorders. Okay, this is what about the second unit.
Okay, the second unit also something specialized unit.
So this is one of the
also this chapter, I think 2 mark or 5 mark question.
They will ask for 5 marks and as well as 2 marks, because we have so many eye disorders. They will ask
this glaucoma, so like that question will ask in 2 mark answer.
Those are all the important questions in this unit, and they will ask about myopia and hypermetropia. Like that they will ask. One of the important in adult health nursing too, ophthalmology or eye disorders.
So next we can move on third unit.
Third unit is completely regarding urinary system.
The renal system.
The renal system and its disorders.
Actually, the renal system is the big topic.
In previous semesters also in anatomy and physiology, it's a big topic, and here also it is one of the big topic. The students have to focus more on this urinary system.
Renal system.
And
their important unit.
And their management, they have to study. One thing they can assure that if they know proper definition of each and every disease condition, they can quickly click in the examination. Because for 10 marks they will ask something means they need to write 2 definition at least,
Yes, yeah.
along with the proper author. That is what the tip, how we need to written in the examination.
Write in the exam,
Yeah,
like
that is what
that,
writing
right.
tips.
Tips.
We need to focus more on this urinary system, like renal disorders, means nephritis, like this kind of disorders. Then in this particular unit, the students mainly know about the little bit review of anatomy and physiology of renal system.
Mainly, I think they will ask UTI something, no?
Yeah.
That UTI, that renal failure. So, like that question, they will ask in 5 mark. Sometimes they will ask in long essay also.
Yeah.
The renal failures.
Yeah,
So, we can everything we can write in the 10 mark question. So I think at least 5 pages need to write, no?
Yes,
in
yes.
10 mark.
Yes, ma'am. When it comes to the 10 marks, from initially we need to start with introduction and end with the conclusion. Okay, that is about the pattern. If they are thoroughly study means they can give nice headings. Okay, while explaining means first they will write a small introduction. I will never say the students to write a page of introduction. It should be very concise form. The introduction 3 to 4 lines,
that
and it
proper
should be
definition also.
Yeah. It should be in like a point wise. Okay, and along with the definition they should add according to whom, said by. Okay, at last it means it will be attract. Okay, because if simply we are writing, the students are writing like a story, it is not a good manner. For that purpose, this is also one of the important. Here we need to study that urinary
Actually,
disease
the
condition.
story is not important. The content is very important.
Yes.
In this unit, the students are gain knowledge regarding the history collection, the physical assessment. So the what is that? That disease-based diagnostic evaluations, the urinary tract infection, everything we can see this topic. This is the very important topic actually. So we can discuss about more disease condition for this topic. No?
Yes. When it comes to renal disorders, the students are going to know about different kind of diagnostic evaluation, because in renal disorders we are going to study about the urinary infections, urinary tract infections, and the meanwhile chronic, acute.
So like these are difference between chronic and acute.
Yes. When it comes to the acute, the duration of the disease will be 3 months. Okay, or very less than 3 months, that will be like that. And when it comes to the chronic, means more than 3 months, up to 6 months.
End of the disease.
Yeah. The duration of the disease will be very lengthy in the chronic. Okay, that is what we will call it as a chronic. And when it comes to renal diseases, we are studying about the renal calculi. That is what kidney stone.
I think the chronic condition means the dialysis, the kidney transplantation. So the patient end of the life, that is chronic. The acute means the first stage of the disease condition. Okay. So like that we can separate this conditions.
No? And nephritis they will study, and nephrotic syndrome they will study. Like that kind of things they will study. Along with this, they are going to study the integrated pathophysiology of renal disorders and nursing management. This is what about the third unit.
I think this chapter also we can added something, the pharmacology, the medication. So what medication need to give. So this chapter also we have something knowledge about pharmacology also.
Yes. Absolutely, you are right. Whenever the students are writing the examination, suppose they are writing any disease condition, they need to write about the management, right? First they will start with the medical management. If the disease condition, by seeing itself we will get knowledge, no, if the disease condition he's having surgery or not. If it is a surgical disease condition, that will be a surgical management we need to add. Okay, but if it is a medical disease condition, we need to write first medical management. Okay,
the pain management also.
Under that we need to mention that the pharmacological management we can able to write that antibiotics we will will use, okay, diuretics we will use. Like that we can able to write the medications
Medication-wise.
under the pharmacological management.
I
Then
think
we
the
can move.
students are something about the medications.
Yeah,
First of
yeah.
all,
Yeah.
two or one example we can give.
Yeah, for example, they are studying pharmacological first and second in third semester and fourth semester. They have the knowledge. Okay, when it comes to this pharmacological management, they will write like antibiotics. Okay, then they will write diuretics. Like this, they will differentiate the medications and they will add there according to particular disease condition. Okay, like that they'll add, and next they will move towards the nursing management. Like this, they need to add in the examination. That is what very
This
important.
is the examination pattern only.
Yeah. If we will write like this, mean the student will write like this, means definitely they will get the mark. So many people, they don't know what to write. Simply they will write
Actually,
a story.
that is the main problem.
Yeah.
How to write exam.
Yeah.
So
That
how to get good marks. That simple tips is there, no?
Yes.
So that is the main content.
Yeah.
So actually we can give first proper definition, then classification, then management also, then like example wise 2 or 1 medication, so they will get good mark.
Yeah. They have to write like in this way only, okay? Because they are doing simple mistake, that will going to be lose the mark. The student will fail. That will be very bad to the students. No, we will give a proper education to write the examination. That is the first and foremost thing in this education system. That is all about the third unit. When it comes to important questions of this unit, like how do you assess and manage the acute and chronic renal failure? Okay, this kind of questions they can expect in the examination.
So next we can move on reproductive system. The reproductive system we can mainly focus the male reproductive system. The example, the infertility, the sexual dysfunction, tumor, breast disorders. So like that it will came. I think we can expect the 5-mark question or the shortest question we can accept this unit, no?
Yeah. When it comes to this reproductive system, in this particular 4th semester adult health nursing, mainly we are focusing on the male reproductive system. When it comes to this unit, we are going to study about the infections like regarding testes. Okay, the infections related to testes, that kind of things we are going to study. Meanwhile, majorly we are going to focus on the infertility, contraceptions and sexual dysfunctions. And one more thing we are going to see in this unit, that is what the male breast disorders like gynecomastia. Okay.
Tumors.
Yeah, tumors. That kind of tumors, the gynecomastia, we are going to study in this particular unit. That is all about. Here the important questions are like the contraceptive methods and male infertility.
The very important question, the contraceptive.
Yeah, and causes of male infertility. Like this, for 2 marks also they will ask what are the major causes of male infertility. Like this important questions we are focusing in this particular unit. The students can able to gain a good marks. Okay. Next we can move towards the 5th unit. That is what burns and cosmetic, means the nursing management related to burns. Okay, when it comes to the burns, we have lot of topics to study. Yes or no? We need to study about the burns and the classification of the burns,
then
and
types, then stages also.
Yeah.
Then I think that every hospital didn't take the burn patients.
Yeah.
So something 10% burn, 20% burn, like that they will take.
According to the severity of the burn they will take, and we have in multi-speciality hospital and all, we have a separate section for to handle the burn cases. Then in this majorly we are going to study about the Rule 9. Okay, Rule 9. They will ask, most of the time they will ask for a 10 marks. And unexpectedly, one of our examination we had seen that 10 marks they are asking about plastic surgery. Okay, here they mentioned that in this particular unit they mentioned about the cosmetic surgeries. In that, one of this plastic surgery is also there. We need to focus on, should not left any content, means any subject in this particular unit, any topic we should not leave. Okay, we should
burn means it will lose so much of fluid in our body. So regarding the vital signs also we knows this chapter. So including the every system, including this burn, that vital, that fluid management, everything concluding this topic. So I think something we can give effect something special to this topic.
And mainly major thing, the students needs to focus, should not leave any kind of topics in this burn, because some students are having the myth like they will not ask this time this question, this plastic surgery, cosmetic, should not leave that. Okay, we don't know what kind of questions they will ask. Should not leave any topic, cover it all the topics whatever they given in the syllabus. That is all about the burns.
Good mark means we will give something special tips for you, so you can follow that one also. So you can write examination, you write the main definition, that classification, that management, that signs and symptoms, like that. So next we can move on. The neurological disorders. The neurological disorder is the main important thing. The neurological system disorders like the meningitis, the stroke, then head injury, the spinal cord injury, everything it will came this fifth unit.
We are going to study about epilepsy, Alzheimer's disease, Parkinson's disease, and rehabilitation therapies, and neurological assessment. Okay, these are all the important topics what we are studying in this particular unit. The student will gain the knowledge about the neurological disorder. Means the first foremost thing is they have to know about all the neurological diseases, because this will be very far sure they will ask for a 10 marks long essay. Okay, the most of the question will come from a long essay from this unit. For that purpose they have to know each and every disease condition, should not leave, and they have to know about the neurological assessment, because if they are studying these things in HN second, that will be very easy to study the mental health nursing also. Again we can study there. Here we are going to study about the stroke, hemiplegia, quadriplegia.
So actually the neurological disease patient means most patient having the unconscious stage. So we can give the score of the patient
by using the Glasgow-Coma scale. These are all the things they will study by knowing the neurological disorders. Okay, but in this unit only they are going to study these things, and moreover when it comes to neurological diseases we are going to know about the head injury. Head
because
injury,
the patient having no sensation, no activity, no facial expression, everything is absent, so we can give something about the patient extra
care we need to give. For that purpose they have to study this one. When it comes to the important questions like they will ask about Alzheimer's disease or Parkinson's disease, and along with the integrated pathophysiology, and they are asking about the medical management and nursing management. Like this kind of questions we can able to expect from this unit. Next we can move to that immunological
conditions.
When it comes to immunological conditions, most of the things we are going to study about the HIV and AIDS.
I think the most people are knows what is HIV, what is AIDS.
Okay, this management. And being a nurse, you should give a health education regarding these conditions. Yes or no? We should have a proper knowledge. Means how much they'll study, that is not important, ma'am. How much depth they will study, that is very important. That's why the immunological disorders, which means that will be majorly affect the immune system, right? Under that they are going to study about
this. I think that this generation the humans are more suffering for this condition.
It is one of the sexually transmitted diseases. Being a nurse, they have to educate the public itself, and they should have.
We can give in that health education for others. The HIV/AIDS don't affair with the disease. Don't affair with the patient also. That also normal humans.
Yeah,
That
yeah,
is only disease condition.
yeah, that is a disease condition. It should not be like through a sexual contact only. It will be like
blood donation,
yeah,
any needle stick injury,
injury and
like
tattoos.
tattoos. We can getting that way.
Yeah.
But now also that every people thinking, oh, that's sexual transmitted disease.
diseases, and they have some myth regarding this. So we should educate the public regarding this, and for that purpose we should have a brief knowledge and regarding this AIDS and HIV and their management, and the government is providing so many kind of facility for the HIV patients. For that and all we should know, and integrated pathophysiology along with this, because we are studying the adult health nursing means when it comes to semester system, it is upgraded version of old syllabus, right? We have to write the integrated pathophysiology in the examination. Okay, most of the things, the important questions, like they will ask about the HIV and AIDS in this particular, and health education. Okay, most concentrate on health education of sexually transmitted diseases, like this we can. And what and all the prevention
Prevention I think is the most important.
Preventions are very, very important. And assessment of the disease, okay, treatment, everything we are studying in this unit. Next we can move towards the next. The next unit is also one of the very important unit. We can able to expect a short essay from this unit. That is what oncological disorders are.
The oncological the department also separate is there in hospital wise, because the immunity, the very low immunity in that cancer patient, this type of patient, like the breast cancer, then that what is that, the spinal cancer, the uterine cancer, the blood cancer also. So much of caring, then so much of responsibility, everything need to give this department. So very, very important topic. The last stage is the palliative care. That also very important thing. So the cancer patient means the type of cancers is there, no? So that breast cancer, the examiner asking what is breast cancer. So we will write the examines what is breast cancer. First of all we will give definition, then classification also there. So in breast cancer, first stage, second stage, third stage, like that cancer also stage wise is there. So first we can write the stages, then that signs and symptoms, the manifestation, the causes, then medical management, then nursing roles. So like that need to give. Then this chapter also we can see something special words, the bone marrow, the lumbar puncture, the blood transfusion, the plasma transfusion. So that transplantation also is there. So this chapter also the very important thing. The students are not much about this cancer. The cancer is so much, I think so much is there. In this generation, cancer is like fever condition. So you can study cancer means the type, the classification, that manifestation, and what is that, the prevention also. Then pharmacology also need to write this unit.
Along with that we need to majorly focus on the management, like chemotherapy, radiotherapy, immunotherapy, gene therapy. So many various upgraded version of medications treatment came in now market. Okay, but that we need to mainly focus on. Okay, we are going to work in the cancer sector, means oncological department. We should focus on these kind of things.
We can expect like this question also. How to do you provide palliative care?
Palliative care, how we are going to provide. And mainly they are asking about the breast cancer, and what is your the prevention of breast cancer,
uterine cancer,
and mastectomy. Okay, mastectomy means what? The removal of breast. If anybody is suffering from the breast cancer, it
hysterectomy
will be
also.
That kind of things we are going to study.
Post and pre operative care, it will came this unit.
One more thing I will tell you in this particular part, you can add everywhere. Already we did video regarding this preoperative and postoperative care in our channel only. Only the thing they are asking about the preoperative, postoperative care, you should write all the care. Like when it comes to the preoperative, you write, you remember the 5 P's and add there. And when it comes to the postoperative care, A, B, C, D, E, F, G, H. Okay, you know already about this. Preoperative care, we are going to write about the physical preparation, physiological preparation, pathological preparation, psychological preparation. The last one is preoperative preparation. The next thing is what? That is what postoperative. Ma'am, we can able to learn the postoperative care in a mnemonic way. Means we can, the students can able to remember very easily. That will be a recovery stage, no? That time A, B, C, D, E, F, G, H. I will tell like that, which means airway, breathing, circulation, drugs, elimination, and follow-up, health education, and general care. This is what the students can able to remember the things very easily.
Pattern.
Very easily. They can write in the examination also. This is also one of the very important unit. Shall we move towards the next unit, ma'am? That is what the 9th unit. It is all about the nursing management of a patient with the emergency and disaster situations. That is what the emergency and disaster management, okay, in nursing. That is what we are going to study in this unit.
The mass casualty, it is called, another name is mass casualty. Like any accident, the mass accident, like one vehicle break the another vehicle. So that time the bus also, the firing bus, the tsunamis, then that, what is that?
Earthquake, like that.
So this is the mass casualty. So disaster also including this one. So this time that the emergency care means the hospital providing 4 or 5 bed the casualty. So the disaster means I think 300 above people are affecting. So the occupation, the patient having occupied the beds. So like that principles of mass casualty, then disaster management, everything under this unit. So that management, the main thing is management. How to manage the disaster. So it the mainly focus the management. So the staff availability, the equipment, the doctors, the everything came under this topic.
Ma'am told that the students will be able to gain the knowledge regarding the disaster management. The very first, we have a preparedness. Okay, this is a medical emergency. The staff and medical team should be always prepared, and availability of the staff will be more if this kind of situations. And we should be always prepared, the beds and all to occupy by the patients. That is what you told, no, ma'am. And in this important questions like
that this chapter we can accept that what is the principles of disaster, then how to manage the disaster. So 2-3 questions we can accept this chapter. Maybe they will ask 5 mark. Sometimes they will ask 2 mark. Like that.
Short essay and short answer kind of questions we can expect from this unit. This is all about the 9th unit. That is what? Disaster management. Next we can move towards the 10th unit, that is what? Geriatric nursing.
So in this unit, mainly we are focusing in the geriatric patient, like elderly patient.
When it comes to elderly patient, we will consider as a vulnerable group. For them, I think it will be around 60 to 65 years of age group people. We are considered as elderly people. For them, they will need a special
care,
kind of care in this
that
hospital
responsibility
sector.
Also need to give extra.
They want to need extra care, which means, ma'am, there when they are elderly, their psychological status will be
memory loss,
different.
yeah.
Some people are suffering from neurological disorders like Alzheimer's and all. Then some people are suffering from, they will lose some any kind of body parts,
Yeah,
or
they're
else,
suffering from family also.
yeah,
Yes.
they will suffer various kinds of disease conditions. Being a nursing student, this is also one of the important topic to gain the knowledge. And
I think mainly the emotional attention.
yeah, they need
want.
they want emotional attention. And meanwhile, they some people used to suffer from deafness and all. Means some kind of prosthesis will be there at that time. At certain age they will not able to accept the thing. That time they want a psychological support. Okay, they need to understand. That means the nursing students needs to understand the level of psychological level of the elderly patient. For that, this unit will be very essential to learn. And if they have proper knowledge, they can assess the emotional status of the geriatric
patient.
and the student can able to render the proper care for the elderly people. Then the people make sure they will get back soon.
So I think this chapter they will ask something about the age-related body changes and how to do affect nursing care. So like that question they will ask. We can expect like that questions. That nurses' responsibilities.
In the
mainly focusing the nurses' responsibility. That 60 or 65 above patient, no, they can't tolerate alone. They want support every time. They want
they will be dependent. They want dependency, but nowadays in a current scenario no one will going to give. That will be a drawback. But being a nurse, if you are going to give a care to the elderly people, 100% you give by yourself. Should not hurt them. Okay, understand the emotional status of the patient and give, and after that you will get some blessings.
I think this topic is something emotional
related. They will attach. Anyhow, we are going to give a care to our grandma and all. No, and same like the students will gain the proper knowledge, how to assess the emotional status, how to give a proper care. Okay, that when it comes to the important questions like roles and responsibility of a nurse in a geriatric care.
Then this aged people facing one main problem is sexual abuse. Sexual and physical abuse also. That age-related people's the facing most important things. This one.
They will face the
suffering
like
this
kind of things. We need to focus on this unit also. They will study means they will get good marks. Most probably they will get short essay kind of questions in this unit.
So this type of question means you can write the story based.
Story based, which means that should be like a point wise. Should not write your own stories. But you have to get a proper knowledge in the particular sector and go for an examination. Should not write any kind of own stories. That's my opinion. And now we can move towards the next unit. That is what 11th unit.
I think this one is last unit, no?
No. It is a last before one. And one more unit we have. In that, we first 11th unit, we are going to study about the critical care nursing. Okay, the nursing management of patients in a critical care unit. Already you know that critical care unit, we are going to give a care to the critically ill patients. And the meanwhile, ma'am, here we are going to mainly focusing on the principles of critical care unit. Means wherever you will go in the hospital sector, certain department demands a huge amount of knowledge and in a specific speciality. For that purpose,
so I think that critical care unit means ICU, like ICU based. The ICUs are different. The NICU, PICU, the Neurological ICU, the SICU, everything is there. So that is critical care. Which patient need to want critical care need to give. So that is called critical care department.
Yeah, sure, ma'am. When it comes to comparison with the other departments of the medical sector, if a nurse is working in a general OPD, is different.
Yes.
And if a nurse is
Absolutely
working in
different.
a CCU,
Yeah.
which means the critical care unit, that is very different.
Very different.
The nurse need a huge amount of knowledge, and the nurse is 1:1 ratio we
Yes.
have in the ICU and CCU. Okay, the nurse is to take care of the patient. Only one patient they will give. That should be unconscious. And,
Unconscious, that
the
medicines,
since-
the everything is there.
Yeah,
In one
everything-
patient having lot of diseases.
yeah.
So every time the doctors will come that round, everything need to manage the nurse only.
Yeah.
So that time the nurse also we can
physically stable and mentally she
mentally,
should be
yeah.
stable. Means whenever we are studying the special kind of departments, ma'am, while studying, no, we will get a huge amount of knowledge in the particular thing. Means we have to work on it. Okay, because if you are working in a CCU, if you worked in a CCU, you know that no, ma'am, we need to mentally prepared and physically stable.
Yes.
We have to put our all energy,
All effort. Yeah.
everything we need to put. And the meanwhile,
I have personal problem means no, it is
No,
not
no.
come to our department or hospital.
Any other.
Yeah.
but we should work.
Yeah.
It should not be like that. We should not already when it comes to, when you are choosing a nursing, means you should not correlated your personal life with your professional life.
Sure,
Whatever it will
absolutely.
be happen in your personal life, that is your personal life. You have to work because it's a service you are going to render to the patients. Next thing is, there is a huge thing in the CCU that because coming to other departments, there is a certain different protocols will be there. Okay, that should be follow you, and different equipments you are going to operate in the CCU. That and all the things you are going to learn. Mainly you have to know about the resuscitation, which means CPR and all.
CPR.
Sudden emergency, we don't know when it will
The
appear.
nurse also don't panic
Yeah.
in that situation.
Yeah. It should not be.
Not be.
Always she should be have a strong mindset. Then only she
Aware
bring
of
back
that
the
one.
life of the patient. She should be like a warrior in the critical care unit. She will work like that. And if we, when it comes to this unit, the students will gain the knowledge about the CCU regarding the protocols and principles of CCU, special equipments, ventilators, when it comes to the ventilation, mechanical ventilation, the types of ventilations, everything they will know. And CPR,
Advanced
care and advantages of nursing care in the CCU, and the ratio of nurse and patient, everything she knows. And feeding, okay, that and all the things she knows. She is going to perform all the procedure, ma'am.
Yes.
That is what she is going to give, render a care in the CCU. They will get a good marks. I think they will ask for 5 marks.
Five
Five marks or 2 marks they will ask. I think they will get a short essay type of question in this unit. And we are at the last session of this podcast. That is what the last unit, that is 12th unit. Occupational disease conditions. Okay, the nursing management of patient with the occupational and industrial diseases. Okay, by knowing itself, name of the patient, the student can able to understand the topics. Right now, ma'am.
Okay, yes.
Means a person is working in some other area except their home. Okay, they will get the disease from the occupational site
to home.
Okay,
Yes.
that is what occupational diseases. Because of their occupation, they are getting the diseases. That is what occupational
Occupational
diseases. The main cause of the disease is occupation, their work. They will know this much. Means by knowing the things, by seeing the things, they have to know the entire picture of the unit. Means they can able to grab the topics. For example, ma'am, in occupational disease conditions, the silicosis.
Silicosis.
Yeah.
Silicosis is the main disease condition in the occupational
disease.
Yes.
Mainly it will affect the lungs.
Lungs,
Okay,
yes.
the nurse, being a nurse, she should know the proper care to eradicate the disease condition. Once it is coming to the patient, means we need to eradicate that one. That is the main roles and responsibility of the nurse, right? And we need to provide a health education.
Education, that history collection, the
assessment.
physical assessment, the diagnostic, what is
Evaluation.
Evaluation, the test is everything need to know
Perform.
about that. Yeah.
Yes, ma'am. And meanwhile, you know, when it comes to this occupational disease conditions, they will have some health education policies. Okay, they should give. Why? Because no, ma'am, some people are working in industry, mines. They have to wear the masks.
Mask.
That can prevent the silicosis. Okay.
I think
and some
we can prevent some disease like
by
wearing mask, then gloves. That something prevent measures is there, no equipments. We can use means control disease.
these conditions, the rate of incidence will be very less.
Very less.
For that, being a nurse, you have to educate the people.
Educate.
Okay, and in factories and all, like industries like
Industrial
cloth
nurses,
industries.
nursing also is there.
Yeah,
The
industrial.
industrial nurse is there.
Yeah.
So that time that nurse should learn.
Yeah.
The nurse first learn, then teach others.
Yes.
Educate
Then-
others.
Yeah, then only we can prevent these
Prevent
diseases.
this.
Oh, in this unit also we can able to expect
I think this
2
unit
marks.
is very little unit.
It's a tiny
small
unit.
Yes.
Yeah. We expect 2 marks,
Yeah.
either 5 marks.
5 marks.
Like that kind of questions will come. So far we had discussed about all regarding the adult health nursing too.
We
for
hope all are understood this syllabus.
yeah, and this will help you to get a proper marks in the examination, which means upcoming December examination.